in Quebec, there's some opposition to a federal government plan to dip into the telemedicine business, or more specifically to create obstacles for it, because there's some at the federal level who feel that it's interfering in the public healthcare system. Of course, the premiers, many of them conservative, not happy with that potential interference. Joining us now is Krystel Witteveongel. She is the Director of Research at the Montreal Economic Institute, and she co-authored a study on this topic. Hello, how are you?
Hi, I'm good. Thanks so much for having me.
Thanks for joining us. Your boss at the MEI, Daniel Dufort, wrote in the Financial Post that telemedicine works. Don't let the government near it. First, tell me a bit about what you know about the potential changes coming to telemedicine. What is the federal government looking at doing exactly?
So currently, the federal government announced its plans to crack down on telemedicine services in Quebec, meaning that they want to have telemedicine be offered exclusively under the public health insurance plan, whereas right now many employers offer coverage through private insurance plans to access these telemedicine services. But ultimately, the federal government wants to see the province paying for this and not a private insurance or other form of payment happening.
And why is that? What's the argument behind that? Does that have to do with access to medical services, or what's their logic?
It's another clear-cut example of the federal government overstepping in the area of healthcare. This is a service that is offered, pretty exclusively across the board. Here in Alberta, for example, the provincial healthcare insurance plan does pay for it, but you can access it also on another level elsewhere. But in Quebec, about 2/3 of Quebecers have access to it through their employer. And so the government really is positioning it such that it's an access issue for those who don't have coverage and would be required to pay to access telemedicine.
So are these telemedicine services taking resources out of the public system? And, from my perspective, and I've worked a little bit with telemedicine companies, I see these services as sort of the Uber of telemedicine. A lot of doctors do them in between shifts, on weekends, evenings, to sort of pad their schedule, make a few bucks here and there. I'm not really seeing any doctor sit down and do it full time and take themselves out of the public service to do that. What is your take on the argument that this is affecting public resources?
We also don't see that happening or being a potential in the future. Telemedicine really isn't drawing healthcare professionals away from the public system. It's simply increasing access for people in general to access for some of these minor ailments. Like if we look at nurses, for example, which isn't doctors, but it's, the same argument. In Quebec, for every 100 nurses that enter the workforce, 44 of them will leave before they turn 35 because of the bureaucracy, because of the public healthcare system management. And offering something like this for not only the public to have access, but also to these health professionals to have a little bit more flexibility in the way that they operate and in the way that they are able to offer their services in their downtime or in, alternate methods and forums, really just adds to the access for Canadians overall.
Krystel, that's interesting that you talk about, overall access. I'm somebody who benefited from the American healthcare system because I was living in the United States when my kids were born. And of course, the American healthcare system, extremely difficult to navigate. There are some real examples also of failure with the American healthcare system. So I appreciate the Canadian healthcare system and I appreciate the principle of universal access. However, I also understand through having experienced it, some of the gaps that can possibly be filled by other things such as telemedicine. Now, could you speak to us a little bit about where telemedicine has been most effective and sort of where you draw the line? What are the areas that telemedicine will never step into?
Yeah, I think it's interesting that you bring up the American healthcare system as well. I just want to make a very clear statement right off the bat is, a big problem with any discussion with non-governmental provision of services or outside of the government system is that we're automatically going to be in the American system, and there's plenty of universal systems across the world who operate much more effectively than Canada's that are not the American system. But when it comes to telemedicine, what it's really effective for is for the minor ailments. So the things that are non-urgent in nature. In Quebec, we see the median or the average, wait time in the ER has been about 5.5 hours. And that's a huge amount of time for a lot of people who don't need to wait that long, who don't need to be there to begin with. We see that last year, nearly 12% of the people who went to the emergency room in Quebec left without being seen by the doctor. So it's these people who are non-urgent who could benefit the most from what telemedicine offers. And then as a domino effect is it does take those people out of the emergency room because so many people don't have family doctors or, an outlet that they can access care for these non-emergent issues. So they are going to the emergency room. And when they are no longer clogging up the emergency room because of things like telemedicine, the people that need to be in the emergency room and need to be seen in less than 5.5 hours are able to do so. So it's really just a beneficial kind of domino effect throughout the system for starting from, these non-emergent minor ailments.
We're almost out of time, but I just wanted your quick reaction to something I mentioned earlier in the show. For my business, I was mentioning I did, over the course of the pandemic, write a press release that stated that the Quebec government was actually delegating telemedicine, in this case psychological services, to a private telemedicine company to fill the gap that was needed during the pandemic as the public system was overwhelmed. They were actually asking private business to contribute to the public system. That, to me, seems like a more cooperative model than what the feds seem to be cooking up.
Absolutely. And Quebec is spending $62 billion on healthcare this year. Do we really need to add more spending on the public healthcare system? It's quite atrocious. We're not just absorbing the cost, we're also introducing the troubles of the current system, which is these lengthy wait times and these other things that we see as a result of, putting everything under the public umbrella.
Krystel Witteveongel is the Director of Research at the Montreal Economic Institute, and she studied this topic, telemedicine. Thank you very much for your time today.
Thank you so much for having me.